Good afternoon, everyone. Gareth Presh, founder, CEO of the World Health Innovation Summit, but also the CEO of the Global Social Prescribing Alliance. Delighted to welcome you to our next session. We're going to take a deep dive into youth engagement, digital tools. We've got a number of experts who are actually delivering this on the ground right across the world. Delighted to welcome colleagues from all over the world. Lamek's joining us from Africa and Kenya, and also we've got Duaa joining us as well from the Middle East, from the GCC. So let's just start with a short round of introductions. Please, by all means, if you have a comment or you want to make, please tell us where you're from as well if you're tuning in. And let me start with Ushma, who's in Holland at the moment. Ushma.
Thank you so much. Thank you very much for the opportunity. My name is Ushma. I am the CEO of Rypple. We're an organization based in the Netherlands that supports public sector, but also private sector to shift toward prevention, toward more upstream decisions. So we support them with lots of advocacy around this as well, but also digital tools.
Thanks a million, Ushma. That's nice, short and sharp. Duaa, who's joining us from the GCC region. Duaa, pleasure.
Hello, everyone. Yes, thank you very much for the time and the opportunity. So my name is Duaa Mohamed. I'm originally from Sudan, but I'm residing in the United Arab Emirates. Currently, I am in the intersections of healthcare and sustainability, and the founder of EcoRx initiative, which aims to reduce the waste from the pharmaceutical sectors. And also, I am a pioneer in the art and healthcare intersections, and I'm very glad to be part of the here and looking forward for this conversation. Thank you.
Thanks, Duaa. Ben.
Hi, everyone. I'm Ben. I'm based in the UK. My background's in musculoskeletal rehabilitation research, but over the last 10 years, I've been working in the delivery of community health, well-being, musculoskeletal and rehabilitation services in community settings, facilitated by technology and the upskilling of community staff. In the UK, I've been running and delivering programs in over 400 community settings, putting health and well-being services and facilities at the heart of communities, mostly in venues such as leisure facilities, gyms, public swimming pools, libraries, care homes as well, so that communities have greater ownership and resilience in health and well-being, rather than needing to be dependent on traditional healthcare systems and services.
Thanks a million, Ben. Lamek, pleasure to see you.
Hi, thank you so much, Gareth. My name is Lamek. I'm from Kenya, eastern part of Africa. The director of Afya for Africa. My background is psycho-oncology, and Afya for Africa, we are focusing on health, education, gender, and climate intervention. Also, we work closely with the cancer patients and caregivers. Yeah, that's all about me.
Thanks, Lamek. Ian.
Good afternoon, everyone. It's lovely to be here. My name is Ian. I am the CEO at Mind Over Mountains. We're a UK-based mental health and wellbeing charity. So we use the power of the outdoors and nature to help people with their mental health and their wellbeing. And I'm looking forward to telling you a little bit more about it over the course of this session.
Thanks a million, Ian, and we'll get into a deep dive discussing sort of grassroots initiative, youth focused mental health support, and putting them at the heart of community. David.
Thank you, Gareth. Thanks for the invitation for being here today. So David Kerr, I'm the co-chair of the Sustainability Value Collective. We're a partner ecosystem that works to help organizations reframe sustainability, where they can look at it as a catalyst rather than a cost and help to drive long-term sustainable value through that. And that applies particularly, of course, to healthcare and social prescribing.
Brilliant, David. So let me just, because I think it's important to sort of frame this, and let's start from a digital perspective and get some insights from Ben. Ben, perhaps you could set the scene. I mean, Good Boost, pioneering work all over the world, not just in the UK, but you've reached out into other jurisdictions now. and sort of scaling up this community-based model around digital healthcare and the infrastructure within the swimming community. Perhaps you could set the scene and give us an insight into how it supports people's mental health and well-being.
Sure. So the very foundation principles was about meeting people where they are, looking at community venues, looking at spaces that people congregating naturally. We know that takes part in gyms and libraries and these types of spaces. So how was it possible to bridge either the knowledge training gap using technology, so it was possible to deliver tailored and personalized programs for health, well-being, rehabilitation in these venues without needing to have a clinician on site? That isn't saying clinicians aren't incredibly valuable and important, but there is a global shortage of clinicians, and so it's critical to find a way to bridge this gap. We've really been pioneering this over the last 10 years, putting digital solutions into these community venues, putting tablet computers, AI technology for group programs and individual programs led and delivered. What it looks like in practice are mostly group classes, timetabled, whether it's in the swimming pool, a studio, or in a community hall. Importantly, over the last decade, we've been gathering lots of data to evidence the impact, the effectiveness. We've published 5 peer-reviewed research studies. We've achieved clinical certifications. And this is really important with digital technology. It's meeting people where they are. It's using digital technology to bridge the knowledge gap, but then having the evidence to make sure there is trust within the clinical community, healthcare system to be on board to create pathways from health into these community settings. And evidence is a really key part of that.
Yeah, thanks, Ben. And I wanted to bring in Ushma, because Ushma, you're doing pioneering work around the prevention loop, measuring this. Please give us an insight. You're doing you've got a paper coming out as well with European partners. Explain to me, to the audience and to colleagues here, how you're stitching this all together.
Thank you very much, Gareth, and thank you very much for the opportunity. So I think the way we're trying to go about shifting the system a bit more toward prevention is by engaging lots of non-health stakeholders in the decision-making as well. So one part of that is a tool that we've built that helps calculate the return on investment of preventive interventions. And these preventive interventions can range from public sector interventions like regulations, tobacco taxes, or community-driven interventions that can be led by civil society, or also startups or impact startups as well. And they can really range from things that address air pollution or clean air, clean water, but also things that engage community in addressing loneliness, so mental health topics, can also address nutrition, physical activity. So it really doesn't matter where the interventions are coming from. What we're basically saying is that the economy does win from implementing these interventions. And so this is where we kind of bridge the actors that are not traditional in the healthcare sector. So quite some unusual suspects, I would say, and bring them into showcasing what is the health impact that they have, and then what health impact, how the health impact that they have actually benefits the economy, so that we can mobilize funds in that direction as well. So we take this very cross-sectoral approach to the public sector as well, so we can mobilize some funds in that direction as well, and be very mindful and concrete that this is for decision making. So we do want people that are using this tool, decision makers that use this tool, to actually we target our KPIs or our key performance indicators within the tool specific to what these decision makers actually care about, whether it is GDP, or it is unemployment rates, or it is incidence reduction within certain diseases that they care about. We try to bridge it like that. Yes, I think lots has also to do with partnerships. This is not an initiative, but like a movement that cannot be done alone. So Gareth, you had hinted already about our upcoming paper as well. There are lots of partners that we're building partnerships with, and we're very much looking forward to all of the knowledge and wisdom that are coming from these organizations to actually make something happen and move away from talking, but actually get some action in this as well.
Perfect, because that's what we need is action, and that's why I want to bring in Ian next, because Ian's definitely taken action, particularly around bringing in nature-based solutions. Ian, from your perspective, bringing this all together, please give us an insight from Mind Over Mountains and what you're doing.
Yeah, thank you. So Mind Over Mountains, we will, as I said, use the power of nature. We take people out on walks, so wellbeing walks and retreats. So we are award-winning and research-backed. We will walk across different parts of the country. We do a lot of work in the Peak District in the UK, the Lake District, the Chiltern Hills, and across the country of Wales. And so we will take groups out on what we call wellbeing walks. And the bit that makes us different is we have counsellors, coaches, and psychotherapists alongside mountain leaders. So there's always professional, paid, qualified members of staff who are helping to literally guide the walk. If they're the mountain leaders, they make sure that people stay safe and we don't get lost. And then the wellbeing team are there to pick up some of those emotional, mental health and wellbeing conversations. So we really find that this can be an incredibly powerful kind of combination of ways of working. And when we're bringing it together, we've got the element of nature. It's getting people out into the countryside. It doesn't have to be a mountain. It's often a mountain, and you get that kind of challenge of trying to reach the pinnacle. And there's lots of analogies we can make there with people's journeys and their stories around their mental health and reaching the summit of something, or as they try and reach the summit. So you've got that wonderful power of nature, getting a little bit closer to the outdoors, to animals, to streams, rivers, mountains. It's a wonderful thing. Then we've got the element of physical activity. So people are physically active. They're going for a walk. As I said, it doesn't have to be mountains, but if you want, we've got gradient different walks. So sometimes it could be, kind of flat and across a field, or sometimes it could be up an actual mountain. We've got the wonderful part of human connection. And so I've mentioned the professional counsellors and coaches that we have ourselves, but when we're walking shoulder to shoulder alongside other people who have gone through something probably quite similar to us, that's an incredibly powerful element as well. So you've got that peer support, the human connection. And we talk about drift coaching. If you think about it, you've got the whole day's worth of walk. In some of that time, you might be on your own. In some of that time, you might be in a small group. You might be with a partner. In another moments, you might be together in a really larger group. And so you've got that moment to drift up and down physically and emotionally as part of the conversation. And so all of this is being held together by our professional coaches and our counsellors as they're walking around. And so we do a lot of work in our open sessions, which is all members of the public. So from a green social prescribing point of view, we know that a lot of our referrals come in through doctors, GP surgeries, various different connections that we have, and we're trying to grow that regionally in the 4 or 5 key areas that I mentioned already, really trying to put down some deep roots in those areas with those relationships. But then we also do a lot of work with businesses and corporates. Sometimes that's linking in the fundraising challenge side of things, and sometimes that's actually going into the organizations themselves and supporting workforces with their own mental health, because I know I'm speaking to the converted already, but everybody has a mental health journey at a spectrum of good or challenging mental health. And so we can be there to support it at whichever level that requires. And some of the biggest parts that we're really proud of, just as I wrap up here, is in the emergency responders work that we're doing. So we've got some great relationships with the police, the Royal College of Paramedics, and various other emergency responders, the Blue Light Card Foundation in particular. So in that whole who cares for the carers approach, if you've got people who are out there doing the work that keeps us all safe and healthy, we're trying to support those guys, men and women, to be as kind of responsive and supported and increase their mental health when we hear lots of words around trauma, burnout, stress, So yeah, the expression to recharge one's batteries is often heard quite a lot when we're supporting people with their mental health and their well-being.
Thanks a million, Ian. Great insights as well, and such an important point to make around burnout. But I really want to speak to next. Go to Lamek, and Lamek, perhaps you could give some insights. I know you've been doing incredible work, or even surrounding World Health Innovation Day as well over the last few years. You have mobilized communities in Kenya just off the bat on your own initiative. I think it's just a fantastic insight into what can be done and achieved. And the work you're doing to support cancer patients in very difficult circumstances.
Yeah, thank you so much, Gareth. I'm really happy, and I really appreciate being one of the panelists in this conference. Yeah, I've been involved in several community activities, including organizing the World Health Initiative, which we did activities on World Health Initiative. Yeah, so at AFIA for Africa, we are looking at four thematic areas, that is health, gender, education, and climate intervention, as I mentioned earlier. So in health, we work very closely with the cancer patients and their caregivers, whereby we do a lot of social prescribing, connecting them with the resources, providing services, navigating them around. They need support when they need in treatment. And then in gender, we do capacity building through training for the young women and girls. And also in education, we are providing mental health to the students, learners in senior school, whereby we go and them on mental matters. And at the same time, we provide them with the school uniforms because these are teenagers, and you realize that poor school dressing code sometimes lower their self-esteem and brings more of poor performance. So we came in to provide the school uniforms for them. And then lastly, in climate change, we do climate smart agriculture training, farmers how to do biochar, using black soldier armyworm, at least training them on how they can keep the black soldier armyworm and then get organic fertilizer out of that. So basically, when we talk about social prescribing within our organization, we fit so much very well into this, and we are doing this to see the community improving livelihood and also helping our community to get much more better in terms of income, health, and also using the local available resources. We are looking into partnership, especially in our new program of gender, whereby we want to focus on learning. We are trying to bring in microfinance to the gender capacity building so that these women can get into businesses, giving them smaller amount of money, and then they share that as they return a smaller percentage to the organization. So we are looking into partnership on the same, and apart from that, this year also we are looking into having an activity for World Health Innovation Day. Yeah, thank you so much, Gary.
Thanks, Lamek. You're giving a great insight into sort of like the grassroots initiatives and how you are mobilizing the local communities within Kenya. Just really appreciate you sharing that, and how I think we touched on this previously at some of the earlier sessions, that a lot of people are doing social prescribing, but they're not aware that they're doing it. It's actually embedded already within the ecosystem. Duaa, I would love to have some insights, because you're in the GCC in the UAE. We've spoken many times. EcoRx is doing incredible work around digital. Can you give us an insight into the sort of tools that you're developing, and how this can support mental health and putting these in the heart of the community?
Okay, thank you. So in the GCC, what is still the practice that is the treatments and the focus on the treatments, which is like costing the governments a lot of monies. But in the recent years, there's somehow shift into the preventions, and this the health is not only about medications and going to the hospitals, which is the practice for a long time. And as a pharmacist, I also know that, because I'm the one dispensing a lot of chronic, and we have a lot of practice of polypharmacy in the hospitals, which is costing a lot of money for the governments, because most of these medications are covered by the government sectors. So and there is a huge waste happening from these medications. So I came to and there is a lot of patients who are coming, and so I'm talking about, that some solution really come from patients, and the needs, it comes from the community needs. We feel that there is a lot of waste happening, and we don't know what to do about it. So we came with the project of EcoRx, which is aimed to reduce this waste, and which we know that's how it's costing and really impacting the environment in a very hugely negative, whether it's in economic, environmental, and different and social aspects. So we engaged the patients with this kind of program in the beginning, where the patients who are aware about the excess of medication and the surplus they have, and they are the one who's suggesting to return it and find a proper way, with whether it's to dispose it with the municipalities organization, or whether to take it, if it's really valuable, to the different charities in the UAE. So we had to work on this platform where this kind of patients have this kind of connections with either the let's say the different charities, and we are working with the different now charities to do that. So now I'm talking that we are giving the patient a purpose, like they are the one who is volunteering, and they want to do some kind of social work in these aspects. So here we are talking about social prescribing and the importance of that. Everything is really interconnected. You cannot separate things from each other, and health is determined by many factors, whether it's social, whether it's environmentals. So I think that the digitals is very important for us. We are working still in this stage on providing the right platforms and the tools, but it helps us also. We are working a tool that we are calculating if this amount of medications is thrown in the environment, how much CO2 emission we are getting. So these of things, it is really easy to, it's important to be shown to the governments. And when we speak, we need to, because it's all about how you show the numbers and the metrics and the impacts your initiatives is like doing. And that is all what I think is the importance of digital.
Thanks a million. This is some great points there, May. Just a couple of points to make on it as well. So, with the disposal element, there's also contaminants of emerging concern. There's antimicrobial resistance. All that waste is going into our waters. So really serious problems that we have coming around the corner. The point you make about the social determinants of health, let's just frame this, and I mentioned this earlier, the huge opportunity that prevention presents in terms of economic uplift, because we have a $12 trillion ecosystem that just supports 20% of our health and well-being. 80% is in the community, and that's the area of focus. And when you talk about the digital opportunities, so everyone here has digital solutions. Ben, Ushma is showing, the opportunities. Lamek has significant opportunities in Africa. Ian across nature-based solutions. But then what we need is platforms, we need collaborations to be able to pull this all together. Sustainability WHIS and David, that's where you come in with the Sustainable Value Collective, and perhaps you can give us an insight into the kind of group and the work that we've been doing behind the scenes to make sure that we have the infrastructure in place.
Absolutely, thanks Gareth. And I mean, so many great points touched on today. I think, look, to take a step back first to really encapsulate what we're trying to do with the SVC, Sustainability Value Collective partner ecosystem, I think it's important to apply context, begin with a simple observation. And that's the fact that we know social prescribing changes lives. We know that prevention works. And like I just touched on, across 40 or 50 countries represented here today, there's incredible initiatives improving health, well-being, and community resilience. So the question is no longer whether these programs work. The real question is, how do we help thousands more people, billions more people benefit from them? And to take that context deeper, throughout my career in digital transformation over the last 15 years, I've seen the same outcome time and time again. And this is where organizations or projects rarely fail because they lack good ideas. They struggle because successful ideas remain isolated. So this is where we've got one brilliant clinic, one awesome pilot project, one passionate community organization. The challenge isn't innovation, it's implementation, it's scale. I mean, to take that further, I've seen so often how we think digital transformation means buying better technology. But technology doesn't scale programs, organizations do. So digital isn't the destination in itself. It's the infrastructure, it's the tool, it's the medium that allows successful community initiatives to become repeatable systems. So that's one of the reasons we're working to develop this platform through the Sustainability Value Collective, initially working along a framework called the Sustainability Value Framework. And I won't go through it in detail, but what's interesting is that the principles of this framework apply just as much to social prescribing as they do to help enterprise transformation and realizing and reframing what sustainability is. So if we're serious about improving the efforts around causes in social prescribing, such as youth mental health, we need more than just brilliant projects, because we have a multitude of brilliant projects here today. We need systems that allow these brilliant projects to spread, to grow. So imagine if every local initiative could be supported by digital infrastructure that enabled others to adopt, adapt, and improve it. Communities wouldn't need to reinvent solutions. They could build on each other's successes. That's where digital can really make its biggest contribution. So we have to ask ourselves, not so much how do we scale social prescribing, but there's a much bigger question. How do we build organizations that are capable of scaling social prescribing? That's the gist of it. Because scaling social prescribing isn't about finding more good ideas. I've just said we have a multitude of good ideas here today. It's about building organizations that are capable of turning those good ideas into sustainable systems. And that's why through the Sustainability Value Collective, we don't begin with technology, we don't begin with reporting, we begin with organizational capability. Because capability is what allows digital tools, partnerships, governance, and community initiatives to endure long after that pilot is ended. So operationalizing sustainability isn't about just improving the report. It's about improving the organization that produces that report. That's our principle at the SVC. We don't need another generation of successful pilot projects. We need a generation of organizations capable of taking what already works, sharing it, strengthening it, scaling it together. We need that platform. And this is where I think we can do something different. So my invitation for everybody watching this here today or catching the recordings afterwards isn't simply to attend another fantastic summit, as incredible as today is. It's to become part of that community that deliberately connects ideas with implementation. If you're developing a successful program, share it. If you solved a problem, help another community avoid solving it again. If you have digital capability, lend it. If you have governance experience, share it. If you have influence, open doors for others. Because the future of social prescribing won't be built by one organization. It's going to be built by thousands of people making those connections across communities, sectors, and countries. And just let me finish on this. Let's stop asking how we scale programs. Let's start building capability to scale each other. Thank you.
Yeah, brilliant, David. I couldn't agree more. I mean, and we're going to take a deep dive. We're going to go back to Ben now because, you know, Ben's building those companies. You know, that's what Ben's an expert at doing that for the last few years. There's no one better placed. And then there's other examples from Ushma and Duaa and that. So we'll bring them in. But Ben, you know, building on what David said there, build the companies and then scale and work together collaboratively.
I agree completely with David. I think it is critical to invest as much as implementation as in the technology itself. Variations regional in delivery makes it really challenging to scale things often, and is often when things don't work. When things don't work, there isn't a time of reflection. It's very much when trying to implement technology, if it doesn't work in an area, it's just, oh, well, the app didn't work, the software didn't work, the technology didn't work. I think we also need to look more about, is it the seed or for a reason why a plant doesn't grow? Is it the seed that's the issue? Is it the soil? It's the same. Is it the technology that's the issue? Or are we not putting enough investment into the implementation and the soil and the environment needed for digital technology to be successful, to be adopted well, to be integrated into the wider network, to actually make a difference in people's lives? Just throwing apps at the health inequalities, health challenges is not the solution. It's been 15 odd years of health apps. There are 300,000 health and wellbeing apps on the App Store. It hasn't been the panacea to date. Global health and wellbeing continues to get worse rather than better. So I completely agree with David. We need to put more emphasis on implementation and more reflection when things don't work. Why is that? And often my anecdotal learning is that it comes down to it isn't taking on effectively. There isn't the space, time, and resources to implement it, rather than the technology itself is the problem. Within that, then, a key part of implementation is trust. Now, we are the digital provider where we work with communities. We don't manage the community buildings. We don't manage the community assets or the people working there. They are not our employees. What we do is we provide a lot of training, support, and skills for them. And some of that is also explaining to venues that to implement this well, there is a certain magic mix of a recipe, but if you follow the steps, you can implement things well. And a key part of that is trust. And trust often between the service recipient and the venue delivering it, or the service itself, but also the wider health ecosystem. Where we see really our program being much more successful in community settings is where there was great trust built between the venue and the staff and local clinicians and health systems. And the reality is that takes time. It takes time to build those relationships. We've worked to kind of create some shortcuts, and some of those are that we've published research, we've got clinical type marks, we're a class or medical device. All these things are some shortcuts to trust. But ultimately, the real takeaway that I've seen is that trust is built over time between people. People do things for people. They don't do them because of institutions or organizations. It's a human-based level that needs to be happened. So, which is frustrating, because it does mean scaling an intervention does need that time. It isn't just a case of throwing technology or throwing a campaign at a problem, expecting it to be successful. We need to recognize that digital is only going to work where it has a huge element of human interaction and human implementation.
Thanks, Ben. I want to bring Ushma in because you're sort of in the space here of trying to build the trust in a new field, because that's what takes so long. Ushma, you know, the digital aspect, but building on what Ben's saying in terms of like that opportunity that is there, and David has been outlining from Rypple's perspective. Give us your insights.
Thank you very much, Gareth. So I completely agree with the previous two speakers, with Ben and David. The way we see it a bit is like infrastructure. The way we would go about infrastructure. Why is infrastructure so attractive to invest in? Is because it has a positive impact on the economy, but specifically also because it has such a tremendous impact on adjacent sectors, and this ripple effect, and that's also the reason why we name our organization like that as well. But this ripple effect is very, very predominant, and sometimes, unfortunately, it is quite invisible, which is where we see our work within our organization to make those invisible connections across sectors very visible. I think part of infrastructure, I really echo what Ben had mentioned about trust, because part of infrastructure also includes these invisible elements of relationships amongst different organizations, in the end amongst people. And it also comes down to cultural elements as well, because specifically on prevention, I think we're all raised with watching movies of heroes where with Wonder Woman and Superman and Spider-Man and I don't know what they're all called, but all of those stories have something in common, and that is that kind of the situation gets worse and worse and worse and worse within those movies. And then when it's like the worst moment ever, then the hero comes in and fixes everything and is then highlighted as the hero of the movie. And I think that's the way we perceive heroism as well, is having or allowing lots of suffering and then kind of coming in the last moment and then and then fixing things. And the fixing thing is what is being rewarded. And I think that's where prevention has a difficult task or an additional hurdle to overcome, which is a cultural one, is because there is not so much reward mechanisms there at the moment. So this is something that we do want to change, and I think that's why a specific focus needs to be set on incentivization structures. So as long as we earn money from fixing things, or as long as we earn money, a lot of money from curing diseases or managing diseases, the transition towards preventing them is going to be more difficult. So setting incentives toward prevention is going to be crucial when establishing this infrastructure of trust and a new culture where the hero is the one that prevents things. Might not be that exciting of a story, but we need to become creative about making this exciting and trendy as well. And the other thing I do want to mention, just because just like infrastructure as well, it covers multiple sectors. Each sector have their own language. And I mentioned it before, quantitatively in terms of KPIs, but it does have a tremendous impact if we slightly speak on, use different words when we speak about perhaps similar things. And I think this is something that is that we are trying to bridge on a quantitative level. Of course, there are different definitions of the same things, or different definitions of similar KPIs, that might still be a challenge. But we're very mindful in when we initiate a project of wanting to shift decisions more toward prevention across different sectors, that we really go back to the definitions. Okay, what do we mean by cost of inaction? What do we mean by preventable disease treatment costs? So how is it exactly calculated, and how can we come on a common definition or common language in there as well? And just one last point, and I'll finish after this, is also a fundamental or the base of any type of infrastructure that is very important to really pay attention to is values. And I read the book of Mark Carney on values. I really recommend anyone that is looking at systems change as well to read that book, just because it really allows you to reflect again, what is it that we want actually when we want to create a system, a new system, or when we're unhappy with the way we are, rather than fixing things that are not working. Imagine what it is that we would like to, what is it that we dream of, as a system, and then really question what values they're based on, and then setting those values very clearly, right? So in today's world, we do have a price for the Amazon. This is what's written in the book as well, but we do have a price for Amazon.com. Now I turned it around, but we don't have a price for the Amazon. So these are things we need to reevaluate. How do we value things? How do we set our values for a system that we want to have?
Yeah, totally agree. I'm going to come to Ian shortly, but I just want to touch on a couple of points that you made there. So firstly, as you mentioned, the values and trust, I think is really important. So we're at a stage in healthcare system, and the current healthcare system, it's losing trust, and litigation is rising, and we can't retain or recruit staff. So we're in a real critical conundrum there. And this new opportunity is, as you say, as we have said, 80% of the social determinants of health, which dictates our health, is outside the health system. So that's a huge and an enormous opportunity when we think about the trillions and billions of dollars that are pumped into the 20%. So this is like an enormous opportunity which we're discussing here. I want to talk about something, and that's why with Ian, the soft power nature, which is not really valued, but there are really pioneering people out there, and Deutsche Bank, for example, is one bank who are looking closely at nature and nature-based solutions and investing in nature. And I think this is such an important point to make. Nature can be a real driver of that infrastructure and that change, because we rely on nature for everything. No water, no health. So we got to be conscious of that. Perhaps the soft conversations, Ian, take place on the mountain, and perhaps you could give us an insight into the power of nature and how we can untap that power.
I'll try. I think that, sometimes it feels like people take nature for granted. They either kind of have it everywhere but don't use it, or they feel like they don't have an access to it. And so I'd encourage everybody to just kind of find their space. Sometimes it is a mountain. Sometimes it's one of the beautiful parks of the world. I was having a conversation recently with our wellbeing lead, who was talking about running a mindfulness session in the middle of a green patch on a dual carriageway, on a roundabout in the middle of a dual carriageway, a big road. And so you can find it kind of anywhere. And so it's just using and tapping into the power of nature. I was really struck by some of our colleagues just now talking about language. And I completely agree as well about the whole trust element and the partnerships approach. And that's absolutely part of the key of how we're trying to do this in a regional sort of way. So to engage with different partners regionally across the United Kingdom. But when we were talking about when the point about language was just made, is I think depending on who we are actually chatting to, people use obviously different language, slightly different definitions to describe probably something quite similar. So when we're talking to NHS or healthcare providers, we need to be able to use their language. We need to be able to talk about the quantitative and the qualitative research that we're doing, and make sure that not only can we talk about the kind of points of improvement that we're making using our outcome frameworks, which is excellent, and we know we're getting some excellent outcomes there. But we've recently started using a well-be model as well. So this is what the Treasury use in the United Kingdom to talk about the credits, a unit of credit of value. And so this has been very useful and powerful for us as well when we're looking at being able to give a financial social return on value as well. So you've got the language of mental health and kind of point scores through WEMWebs, and then you've got the financial outcomes through the well-being side of things. So I think it's that I just wanted to kind of make that point about language. But yeah, I mean, we're trying to, when we're talking about using that power of nature, it's helping people to see what is just in their either back garden, what might be in their local park, we try and make sure that all of our walks are linked to either bus routes or train stops. So recognizing that there are substantial barriers out there, whether that's kind of people drive or don't drive, people can afford to get to various places, people live in cities. I'd encourage everybody to just kind of have a think about what is in their local area, whether it's a canal route. If you're in, I keep saying the UK, but if you're in London or one of our bigger cities, you've got parks, you've got royal parks, you've got lots of big open spaces. So it doesn't have to be a big national district park or a mountain, but there's lots of opportunities for people to get out there. And yeah, we're trying to engage when we're talking about these different partnerships. I use the expression earlier, you've got kind of scaling up and scaling out, and we do want to have more of an impact, but what we're trying to do is to scale deep. And so for us, what that means is we're talking to a number of or as many as we can. We've got colleagues who are based and living in some of the regions we're working in and providing services. And we're trying to have conversations with police, healthcare providers, local city councils, local county councils, everybody from a kind of statutory point of view, businesses, funders, different commissioners, trying to engage with them to use that power of nature to really harness what's out there, what should be free and what should be available for most people. And we're trying to see if we can get more support to deliver the work that we're doing.
Fantastic, Ian. Thanks a million. And I think that the partnerships, as we touched on previously, that's the way forward. I've got to bring Duaa back in here. I think we lost her there for a second, and Lamek. So Duaa, just from your perspective, I'd love to hear some grassroots, like you're doing, grassroots, but also the work in the UAE around mangroves as well. There's a lot of stuff that happens at a local level in different cultures that can be applied and lessons learned. Perhaps you could give an insight into how you're scaling your solutions within the GCC abroad, because there's a huge initiative and there's a huge push, because I think that's a huge opportunity for the GCC.
So I think this for the GCC, the grassroots initiative is somehow new initiatives, because it's most of the things is coming from top down. It is not coming from, as we see in Africa and different regions, most of the initiatives is coming grassroots initiatives. So I think just the last 2 years, 3 years, they start to encourage different and the start of the different organizations to be part, because they recognize that the government alone cannot do all the work. So the government cannot handle all the things that it's happening in the communities in different aspects of it. It's whether it's well-being, with its environments. So there's different social incubators that is coming up now in the UAE. We have in the last 3 years, there's 3 or 4 social incubators that have emerged as part, and there is the sustainability awards is coming. All these kind of initiatives, it is just a support from the governments telling the people, start now. We are supporting you with funding, with everything. Just start your initiative. Show us it's really doing an impact. Even if it's in a small scale, just show us it is some. And this is how is really how is the government is the one now as acting as a mobilizer for the community. And now there you will see that there is a lot of initiatives that is happening, and the rise of public-private partnerships. Before there was not much of partnerships happening. Now there is more looking for people to partners, and they are even from outside. They are telling if any outside organizations, bring your solution to us, show us how we can tailor it to the system, whether it's in UAE, in Saudi Arabia, how we can tailor it to the context, because we cannot just bring any kind of solution and start directly implementing it without looking and considering the social, cultural factors, the Islamic factors in these countries. So this is now the way how is the government is looking forward from a solution outside, and also from inside. They are now because now there is more focus on digitalizations. So most of the let's say digital solutions are happening here, and most of the innovations. So I think this is important lesson for both from countries in the GCC and outside countries. And I think it is this is how how it will be like the way and the future in the Middle East and the GCC specifically.
Yeah, fantastic insights. Thanks a million for sharing. I think it gives us real context as well to the future and the rapidly changing environments that we're experiencing, not just in GCC, but all over the world. And perhaps Lamek, you could give us an insight into what the transition you're seeing in Kenya as well. It'd be wonderful to get an idea of what's happening there. And just conscious, we've got 10 minutes left, so we want to just get a final thought from everyone as well. So Lamek, over to you.
Thank you so much, Gareth, once again. Yeah, since we joined the civil society, I can say that we have achieved a lot in terms of ensuring that there is sustainability and their structures are really working well, especially with the cancer treatment in the country. We came together as a civil society to push the government to come up with the modalities that can work in improving the health sector, especially on cancer treatment. So another thing I can say is that what has really worked so well right now in terms of improving the health infrastructure in the nation is about the government coming up with social health authority that offer services to the community. And right now it's easy with the AI, with the introduction of AI within the health management, that it's very much easy to track a patient when referred from one facility to the other. So the data currently is up to date and things are working. The most important thing that's still pending is the mental health, which is not yet incorporated very well in the health sector. There is still a big gap, which as the civil society we are trying to push it so that they can incorporate it, and also it can be covered under the health insurance within the health insurance. So those are some of the things that I can say as the civil societies we have achieved in terms of health sustainability, and also making it easier for the community to get access to affordable healthcare, and also knowing how to get help where necessary. So apart from that, what I can say that we are still slugging behind as the African nations because of bad politics, but with the goodwill of the people, I see that we shall move forward to the high class health attainment. So thank you so much, Gareth.
Thanks, Lamek. Great insights into what's happening in Africa. We know transformation has happened quickly. David, just come to yourself, the work you're doing at a local level with the SVC, sort of the infrastructure that's needed. And then what we'll do is we'll have a final round of final insights from everyone because we've got about 6 minutes left.
Yeah, at a local level, I think the most important part of what we're trying to drive, the connected platform that we can create with this Sustainability Value Collective, is that, like I mentioned before, any projects, whether in health or different areas of social prescribing, don't just become standalone projects, that they're fully recognized, certified, they're governed, they become part of the infrastructure of any organization. Because I think it's so important that These don't just become standalone projects that can disappear even quicker than they were created in the first place. So I think that's of utmost importance. Yeah, and I think it's important that we're addressing several areas, whether that's in digital transformation, governance transformation, cultural training, education. There's different areas, but we're going to keep growing this platform. As we've seen with many of the great organizations involved here today, there's many areas of social prescribing, which we need to make sure are included in any and all progression.
Thanks for this, David. Let me come back to Ben now. Just Ben, we've got about 5 minutes left. Just some final thoughts from yourself. We'll get a final word from everyone. Future social prescribing, digital health, youth engagement. Sum it up for us, please.
Yeah, I think just to lead up on what was said earlier, that digital is a really powerful resource, but it's the everyday local assets and human connections, which are some of the most powerful tools we have. And I don't believe we are still anywhere near fully utilizing them to deliver health at national and global levels at scales. And I believe the solution to waiting lists and health inequalities is just not simply adding more clinicians into the system. It's about meeting people where they are, in their community, in their libraries, in their faith spaces, at home. The NHS, the other global health systems, if we can get them to work together with these community assets and community spaces and community human assets as well, I really believe this is the most powerful health intervention we have yet to fully scaled.
Thanks for that, Ben. Totally agree with you. Ushma, over to yourself.
Thank you so much. Yes, I couldn't agree more. Lots of work that we need to do. We now need to turn our words into action. I think I'll keep it super short.
Thanks a million. Ian, I think I seen a comment there that you're heading off to Wales tomorrow, so you're certainly taking action with the front foot forward. Your final words?
I think we need to help people feel like, from a nature point of view, that the outdoors is somewhere where they belong. And I think that's a really key part of it. Some people are very used to being outdoors and feel very comfortable out there, and some people need a little bit of extra support with that, and that brings up all sorts of societal kind of inequalities and challenges and historical reasons. So I think it's about us all being very mindful of that and supporting more people to feel like nature is somewhere where they can thrive.
Absolutely, yeah, I totally love it. I was actually at 4 o'clock this morning dropping my daughter to go run up Lancatra. So yeah, that's certainly one way of encouraging activities outside. Duaa, from your perspective, just some final words.
I think just we have to look for more collaborations and partnerships and more involvement in the communities, and mostly the youth in the communities.
Brilliant stuff. Lamek, final words.
Mine is just to welcome anyone who is willing for more collaboration, especially extend services. I like what Ian talked about nature, because I've been using nature in nature therapy for the childhood cancer, especially children with cancer. So it's a good idea and something that can work. Thank you so much.
Thank you very much. Final word to you, David.
I suppose to be very brief, I've been in hospital all week myself, as you're aware, Gareth. So I've seen firsthand the incredible work and overtime that doctors put into trying to look after patients. But I've also seen and heard firsthand the life circumstances and situations that patients have that treatment just doesn't connect with and doesn't meet in the middle. We have so much at our fingertips, so many incredible organizations, so many incredible networks. We can do so much to improve these health services. Let's not be having this same conversation this time next year. Let's get moving and let's do this.
Yeah, I have to agree with you 100%. It's a case of like people's lives are at stake, so it's very important that we take the bull by the horns and we get moving on this. We can only do this together. I think that's the sentiment with everyone here today. Super excited to work with everyone. James touched on it earlier, like this is a community that we're building. That was the purpose of why we set up the Global Social Prescribing Alliance, was to ensure that we could empower people, enable people, give people the voice, and then provide them with the support. So look, very excited. Thanks for joining. Our next session is in an hour, so everyone go get some lunch and we'll talk very soon, okay? Thanks, everyone. Thanks for all the panelists, and we'll talk soon.